Hello friends, welcome back to the healthcare today. Today we are going to speak about childhood tuberculosis or pediatric tuberculosis. So why do we see tuberculosis very commonly in young children? So to speak about it, we have two components. One is the childhood TB, which is coming from the mother. For example, if the mother is having tuberculosis and the child invariably gets once he is inside the uterus, because the placenta is directly connected to the child, and these forms of tuberculosis are usually common with hepatic involvement, which is the liver involvement. These child have jaundice, difficulty in breathing, and at times when the lung is involved, they may tend to be requiring ventilator as well. Now, once you diagnose the childhood tuberculosis, the same treatment is, once you calculate the baby's weight, the anti-tubercular therapy is given according to the weight. Why, apart from childhood tuberculosis is common in children? We all know once children goes to the school, there are around 30-40 child which are sitting in a single room. For example, one of the child is having tuberculosis and is coughing. So the tubercular bacteria is suspended in the air and it exposes all the child who are seated around him. So as we all know, children have less immunity. Whatever the immunity which they have in the initial part of the life is given through their mother. Children contract different infections and they tend to have developed antibodies and eventually immunity for them. So in the initial part of the age group, once there is only mother's immunity and the child is exposed to tuberculosis, and it is very easy for the child to have tuberculosis. So then what we'll be seeing? We'll be seeing fever, we'll be seeing lack of weight gain, and many times you see the child not having appropriate weight for the particular age, which is called failure to thrive. Once you observe these symptoms, you need to visit a TB specialist or a pediatrician who does the initial tests, which include the chest X-ray, CBC, ESR, and see whether there are any signs of infection in the body. Once we confirm, or to confirm, we need to usually send sputum, but many times child is unable to bring out the sputum. It is very difficult to test the child for tuberculosis. So that times what we do is we place a small tube through the nose, enter the stomach of the child and wash the stomach and collect back the sample and send it for analysis, which is called gastric lavage. Many times bacteria can be seen in this lavage and it can be enough clue to start tuberculosis therapy. The treatment for childhood tuberculosis is same as the adults, but only thing is the difference of the dose, because dose is given as per weight. And children, we need to be extra vigilant because whatever the side effects they are having with the medications, they are unable to tell. So the liver function testing, kidney function testing, these are done more repeatedly in case of children. Whereas in adults, we do it more between an organized time gap. In children, as far as the improvement is concerned, we need to be more vigilant regarding childhood tuberculosis. And watching for side effects is also an important part, because as a parent you should be very vigilant whether the child is having yellowish discoloration of skin or any new jaundice or any new lymph node which is coming up. So immediately report it to the treating doctor, so appropriate steps can be taken. And as opposed to the common fear among the parents, once there is a tuberculosis in the children, it is very difficult to treat. It is not the case. Once you diagnose it early, tuberculosis treatment is very easy and the child will be 100% cured. But what happens once you delay the treatment? Once the treatment is delayed and the diagnosis of tuberculosis is delayed after a particular onset of symptoms, for example, you took 2 to 3 months to diagnose tuberculosis. What happens is, if it is a pulmonary tuberculosis, there will be irreversible damage happening to the lung. So as the child grows up, he has tendency to have asthma, COPD, which is post-tubercular COPD, which we very commonly see in India. All these symptoms we may see because of the residual effects of the tuberculosis. So to prevent all of this, please contact your doctor early, and once you identify the symptoms, it is the earliest we start tuberculosis medicines, the child will improve as much as possible. We care about you.